Hi, dear doctors. This is Dr. Ravi Shankar Poliseti, the founder of I-PRISM. I'm a pediatric cardiac surgeon by training and someone who has spent his life at the bedside of the sickest patients. Like you know, I know too what it means to strive relentlessly for excellence. From school days onwards, doctors are trained to be the best, driven by a deep desire to heal, to protect life, and in some way to make the world better. Yet, despite our best efforts, many of us have faced moments that stay with us forever. Moments when a patient continues to deteriorate, when heart failure progresses or an end-stage disease advances. Even after every guideline, every protocol, every standard that we are trained in, and every standard option has been exhausted. In those moments, not only are patients and families exhausted, we as doctors are exhausted too, emotionally, physically, and ethically. I say this from experience, friends. Over the course of treating more than 28,000 end-stage patients in an integrated fashion, I witnessed a recurring reality. When conventional care had reached its limits, patients were often left with months, sometimes weeks to live. Through a structured, translational, and integrative approach, applied only after guideline-based medicine has been fully exhausted, we were able to improve quality of life in nearly 63% of these patients, many of whom are living 5 years and beyond, where survival was once measured in months. And this was possible through our translational research that spanned over the past 3 decades, friends. This is not an alternative medicine. This is not rejection of science. I-PRISM is built on scientific continuity, cultural continuity, and respecting international clinical guidelines, building upon them through translational research and responsibly extending care at the bedside when no standard options remain. I-PRISM exists for those moments when medicine feels like it has reached an end, but our responsibility as doctors has not. If you have ever wished you could do more, ethically, scientifically, and responsibly, I-PRISM is here to walk that path with you. The I-PRISM MD stream is designed for physicians who want to move beyond protocol-limited medicine into innovation-driven, systems-based care. This program trains doctors in translational medicine, understanding how discoveries move from laboratory research to real clinical treatments safely, ethically, and scientifically. You will gain fluency in genomics, bioinformatics, data science, and applied mathematical biology, learning how modern medicine predicts disease, models outcomes, and personalizes care. The curriculum integrates AI-enabled diagnostics, advanced biomarker analysis, and PRISM's multi-axis diagnostic framework to detect disease before irreversible damage occurs. Physicians are trained in regenerative medicine, phytochemistry, manufacturing quality, and integrative pharmacology, ensuring safety, standardization, and evidence-based practice. This is not alternative medicine. It is translational, precision-driven, globally aligned integrative medicine designed for MDs shaping the future of healthcare.